Next motion is motion 4. Adam Morby is speaking from South Staffordshire LDC. Adam, all yours.
Good afternoon, Conference. We're lucky in South Staffordshire in that we have a very proactive area team and an excellent LDN. It's unusual to hear those comments. Funding has been made available to support practitioners for peer review. It's such a beneficial activity for the practitioners in our area. For some, just to share views and ideas and reaffirm treatment modalities. Others, it offers support, very supportive networks when times may be difficult. Currently, Health Education England in this area are making 30% savings as they are elsewhere, but that means that 23 dental tutors are being removed from the system locally. This changing provision in education will have dramatic effects. There may even be closures of the hands-on facilities that we have around the area as well. This will mean there will be fewer opportunities for colleagues to meet and discuss issues. In a profession that can be insular, this can lead to further isolation. Peer review and audit for dental general practitioners in England was made into a substantive system and scheme by the Department of Health in 2001. When the new dental contract came into force in 2006, it was inexplicably removed, some having funding included in their contract values and some not, depending on when you completed your peer review cycle. The regulation of Dental Services Programme Board, whose members include the General Dental Council, Care Quality Commission and NHS England, are keen to implement a quality improvement framework across the dental sector. And the CQC have stated that they expect their providers of primary dental care services to participate in peer review and demonstrate good governance. So South Staffordshire LDC would urge Conference to support this motion to have a properly funded and remunerated peer review for all of the dental profession. Thank you.
Thank you, Adam. Right. Again, as there are no speakers to this motion, we shall go straight to the vote. This is motion number 4. Those in favour of motion 4, please. Thank you. Those against? Any abstentions? That motion is carried. Thank you. In fact, that would probably be unanimous, I think, Adam. Yes, well done.
Hello, thank you. Thank you, Mr. Chairman and fellow colleagues. I'd like to thank you for allowing me to present my motion today. As you all know, the demands upon the profession are unprecedented at present. The locus of control is moving away from internal to external. We're suffering physical confinements within surgeries, greater professional isolation, massive economic pressures, increasing time constraints, and pressures to compromise treatments, along with treating more and more anxious patients, and we ourselves are all type A personalities. We are already pushed over the bell curve from peak performance to exhaustion. A recent document called Probing Stress in Dentistry showed that 50% of GDPs had worrying signs of stress and burnout. Dentists had twice the suicide rates of the general population. Emotional illnesses are ranked 3rd compared to 10th for the general population. And the number 1 killer of dentists is stress-related cardiovascular disease. The scales are further unbalanced. There is diminished clinical support from the secondary care services, limited community care, and the ivory towers are slowly closing their gates. Greater regulation and personal liability stands over us, while our indemnity providers are slowly stepping away. So overwhelming pressures and uncertainty from all sides is upon us all. Under these circumstances, more funding and understanding should be provided for the health and mental well-being of all dentists. Currently, we have the British Doctors and Dentists Group, a support network for addiction. We have the Dental Health Support Programme, a charity providing similar care. We have an NHS-funded practitioners' health programme, which is theoretically free for patients, people seeking addiction and mental health support. However, really, in their own terms, it is only a signposting service and may be able to offer a small group of patients case management. And currently, there's no contractual arrangement for areas outside of London. There is the Alcoholics Anonymous, Narcotics Anonymous, and our steadfast knight in shining armour, the Samaritans. The Department of Health has the National Suicide Prevention Alliance set up in 2013, a multi-group network to reduce suicide rates, improve support for affected groups, principled on 7 laudable key objectives: We are an affected group, and we need more than the current light touch approach. We need tools to help us, safe talk advisors, resilience training to help us realise our potential, arm us with coping strategies, not mental toughness, but adaptive coping strategies to understand and manage emotional needs and the ability to seek support during stressful events. We need help from groups such as Connecting for People to provide a strategic, evidence-based approach to suicide prevention, emotional well-being, and mental health awareness. To the conference, I call for funded services to be freely and nationally available to us all, a seamless integrated service to help us cope with the immense pressures we are already facing. I say stop just clawing back and please give back. Thank you, conference.
Thank you, Naresh. Right. Nobody... Philip, are you speaking to the next motion? Philip, next motion, yeah? Because it's motion 5 you're speaking to. Okay, please come to the rostrum. Sorry, Philip Martin, Leicestershire LDC, is speaking for the motion.
We all suffer from stress in this profession. At the beginning of this year, I organised on behalf of the LDCs in the East Midlands a suicide prevention and stress training programme day. Naresh was one of the attendees. We were concerned because we've seen the appalling situation that's been arising with orthodontic procurements in the south of England. Sooner or later, somebody's going to kill themselves over this, and we need to be watching for it. We've had a local situation some years ago where one of our practitioners faced losing his practice in a procurement, and it was touch and go, and we had to step in and help at LDC. We all need to take action. Please support this motion.
Thank you, Mark. Okay, we have John Milne, GDPC rep, speaking for the motion, or I think he's got something else to tell us.
Good afternoon, conference. I think this is a great motion, but I got an email a few days ago inviting me to a meeting about the expansion of the NHS Practitioner Health Service, which is free, confidential, been in operation in London since 2008, treated more than 5,000 doctors across all specialties with mental health and or addiction issues. And it says here, later this year, we will be expanding this service to include all doctors and dentists across England. So it was just to inform you that as far as I'm aware, what this motion is calling for looks like it's going to be implemented. There may be somebody from BDA who knows different, they might perhaps comment. Thank you.
Thank you, John. Very good. Right, there are no other speakers to motion 5. We'll go to the vote. Those in favour of motion 5, please. Thank you. Those against? Any abstentions? Again, carried unanimously. Well done, Naresh.